Where Candelit Therapy began is I, at the time, was working in public health on mental health awareness campaigns. I was hearing a lot of where the gaps were happening for residents of the city. Where it really started to kind of connect for me was I was at the time also going through my own pregnancy, and I noticed that I hadn't been screened for depression or anxiety during my pregnancy or even after I had my son. And that's when I thought, wait, this is not right. So it really took me channeling a lot of the frustration from being a new mom and struggling and not really knowing where to find support, as well as the knowledge as a public health professional. I really started to kind of think of like, how can we really reimagine the entire care experience as it pertains to maternal health and behavioral health? And also, how can we make that experience more culturally sensitive and appropriate, where women are not feeling ashamed of what they're experiencing and feeling like they're alone. And thus, Candelit Therapy came together. When I applied for the accelerator with Parkview Hospital, I knew specifically that partnering with a health system would be very crucial to our growth. And I loved specifically that we were at the intersection of behavioral health and maternal health, so that we could both shed light on these mental health conditions that do come up during pregnancy and postpartum. Right off the bat, I definitely had really helpful conversations with both subject matter experts at Matter, but also at Parkview Health. So they were able to give me a snapshot of the current state of women of color's experience in Fort Wayne, Indiana. They also were really helpful with giving us a sense of social determinants of health that were significantly impacting their population. We had been really focusing on quality measures with Parkview Health of how can we get a better sense of what does culturally responsive and culturally appropriate mental health care assessment, triaging, and treatment look like, specifically for Parkview Health, given where they're sitting in Allen County, where 13% of the births that happen in Allen County are to Black women, but yet they also account for 33% of the infant deaths. So really thinking creatively about how we can work together as partners to really address what those vast needs are across the spectrum of social determinants